The man has been confronting the coronavirus crisis on two fronts, patient by patient and in the legislature. The last time State Representative Jon Santiago joined us 13 days ago, there were no deaths and just over 250 cases of the virus in our state. Today, as we said earlier, the state is reporting 89 deaths with more than 6,600 confirmed cases and so many more still awaiting tests. We're back with Representative Santiago, who's also an emergency room physician at Boston Medical Center. Doctor, it's good to see you as always. When you were here last time, you reminded me that you work in the busiest emergency department in New England, and you said to me, I wrote it down, I trust in the staff to get the job done. No one questions the commitment of you or your coworkers, but are you still as confident as you were then?
I think so. You know, I've been working the past several weekends, and every weekend there's been a challenge, whether it was how we test patients, how we get our PPE, and how we prepare for the surge that is no doubt to come in a week or two. But I feel confident. There is some anxiety, some angst amongst the nurses and staff and doctors, but we're prepared for this. We're trained to do this, and we want to be here.
You know, I appreciate your confidence, and I believe it, but since I saw you also, we learned today that 10% of the staff at Boston Medical Center, 700 people being furloughed. Last time I saw you, none of your colleagues were infected with COVID-19. Now 51 of them at least are. That doesn't change the dynamic for you and your ability to get the job done, Doctor?
Well, there's definitely a sense of vulnerability that I felt. You know, I took care of a patient who was close to my age, who within a course of 2 or 3 days, he was in the ICU with the breathing tube and ultimately passed. And so it definitely makes it real to me as a doctor who's taking care of patients. And now I'm doing my best to make sure that I'm putting on the PPE, and when I get home, taking off my clothes before I come to the house. But listen, I mean, I have friends who've been infected. A good friend of mine was out for 2 weeks. He just came back 3 days, and he's ready to roll. And there will be challenges, and this is going to be a long marathon, but we're in the fight.
And losing 700 of your coworkers, at least temporarily, doesn't cripple your ability, apparently.
Well, I think we're preparing for the surge. Now, the vast majority of those people were associated with elective surgeries, and as you probably are well aware, they've cut elective surgeries out of all academic medical centers, all hospital centers, because they're non-essential services. So we're preparing for the task at hand, and that is the COVID-19. So we've upscaled our ICUs. You know, we're at about 70 now. I think the plan is to go to 200. Right now, we have about 26 patients, either with COVID-19 or with suspected of having COVID-19 in the ICU. We're preparing, have enough PPE in the building, and the ventilators, we got about 120 ventilators ready to go.
So when you were here 3 weeks ago, I asked you about Governor Baker and the job he was doing. You gave him high grades. Since then, a poll came out, 80% of Massachusetts residents agree with you. You still feeling the same way about the job that Charlie Baker's doing?
Look, I think Charlie Baker has taken a very rational approach to this. He's been talking to the experts. I think he's done a tremendous job in scaling up testing. And if you look at the testing numbers right now, I think we're matching, if not exceeding, what South Korea was doing at a per capita level. And so as we begin to test more, as we begin to increase our ability to contact trace, hopefully we're going to make that's going to pay some significant dividends in the weeks to come.
Is there anything you think your colleagues, you in the legislature, should be doing to protect people? I don't mean from a health perspective, but from the economic side of this, which obviously goes hand in hand. Anything that hasn't been done that should be done by the men and women in that building?
Well, there are a number of things that are being looked at right now, and I think we've heard a lot about housing, evictions, foreclosures. There has been some guidance that the office has sent out to the Division of Banks and to housing authorities. Speaker DeLeo has been very frank about wanting to do something relatively soon. But listen, given the fact that we've extended taxes, income taxes, to July 15th, there's going to be a significant drop in revenue, upwards to, up to $3 billion.
Yeah.
And so we have to plan very smartly and very intelligently, as the economic fallout will last significantly longer than the public health crisis.
I know you treat a lot of undocumented people at Boston Medical Center, and while I assume most viewers know that people are undocumented, even though they work in some of the hardest hit industries like restaurants and hotels, will not get a dollar from the stimulus. Most are ineligible for unemployment benefits. And while the federal government, immigration officials have said they will not conduct enforcement near a health care facility, do you think fear of on the part of undocumented people is keeping some away. I don't just mean some, I mean significant numbers away from getting the treatment they need, both for themselves and for the people around them?
Look, I'm sure that's a factor in this. I mean, given the fact that the tenor from D.C. hasn't been one of welcome. Look, there are 250,000 immigrants, many of which undocumented, here in Massachusetts. They make up 5% of the workforce. But even if you look at the healthcare workforce, I think it's 1 out of every 6 nurses are immigrants, 1 out of every 3 are healthcare aides. So they're an important part of the healthcare workforce. At BMC, at Boston Medical Center, we've done our best to welcome these folks. I mean, COVID-19 testing is free. We've started interventions where we're actually using telehealth to reach out to immigrant communities and making sure that they feel welcome and taken care of. And you don't need a social security number to sign up for Mass Health. So we're welcoming these people like we always have. And we want to let them know that they have a safe place to come get care at BMC.
We only have 30 seconds left. We are 8 days away from the beginning of what the governor says will be the peak period from April 7th to 17th. What do you worry most about with a week to go?
Well, the surge, particularly, does the hospital have the capacity and ICU beds and ventilators to address the needs? You know, right now, the personal protective equipment is still an issue. I'm using one N95 mask a shift. But 2 weeks ago, we had about 10% what we asked for from the Strategic National Stockpile. A week ago, it was 17%. We're up to 36%. I've seen a whole host of manufacturers get on board. And so I'm confident over the next weeks, coming months, that we're going to have the PPE to take care of our patients and our healthcare workforce.
Doctor, good luck to you and your colleagues. Really appreciate your time as always. Thanks so much, Jon Santiago.